them in person, and I'll tell you, they go a lot quicker online just because you don't have that audience participation and feedback. So
Oh, yeah, I'm sure that is true. But then you're not sure whether they're getting it all either.
Yeah, I don't know. Sometimes I wonder.
Well, you know, I think we'll go ahead. I'll watch to see if anybody else is, you know, ready to be admitted. But I want to welcome all of you who are here. We're certainly happy to have some guests from the media. We've got Jan Larson from Independent News, and I think Roger Lapointe from the Sentinel, and we're happy for that. And I'm not sure, Clint was invited. He may come from the morning show too. We'll see.
Jar, I noticed in the chat that Roger said he is unable to make his speaker work, but he's here representing the Sentinel.
Oh, okay. Well, you're better than me. I didn't even turn chat on tonight. That was my mistake. Yes, I see that. Okay. Well, we're glad you're here, Roger. Welcome. And of course, I want to welcome Aimee Adams. You're from the ADAMHS board. That's my problem. Aimee Coe. And we're glad you're here too. Now, I would be fairly remiss tonight if at this very first educational meeting that I've been chair of this mental health committee, not to mention Sally Kilmer, who's no longer with us, who chaired this committee before I did, and actually got us started working on the update to our position statement, because she arranged a lot of different interviews for us to go to or have people come to us, as Aimee did, from various mental health agencies. And that's how we educated ourselves, and we're ready to do a new position statement for the league. And then about a year ago, we did have Aimee for us. And so we were so excited by what she presented to us, we wanted to share it with a lot of other people. We had hoped a lot of other people, the public of Bowling Green, but it didn't quite work that way. We're hoping maybe our media people can help us a little bit with that. I would also be remiss if I don't mention my dear friend Judy Knox, who was my mentor in even beginning to do this mental health committee. And she also was a person who just had so much knowledge that I wouldn't have begun to have, and knew all the people that we should contact and talk to, because I certainly didn't have the experience that way that she had. So I will greatly miss both of these very wonderful women. They were a big help to the league and to this committee. I also want to acknowledge the other members of my committee. I had hoped some of them would get here, and Jane is here. The other ones are Martha Feather and Brenda Pike and Judy Wilbarger. And Judy, I don't believe, is probably going to be on Zoom, so I didn't expect her, but I think Martha was planning to come. Maybe she'll still get here. I'm not sure. She does do some traveling these days with grandchild and so forth. So anyway, at this point, I'd like to just tell you a little bit more about Aimee, and then we'll let Aimee do her presentation. Aimee Coe joined the Wood County Alcohol, Drug Addiction and Mental Health Services Board, ADAMHS for short.
It's a mouthful.
Much easier to say ADAMHS. As the director of the community programs in January 2018. Aimee received her undergraduate degree in criminal justice and a master's in rehabilitation counseling from Bowling Green State University. Imagine.
ABG.
Aimee has worked in the behavioral health and criminal justice field throughout her career in roles ranging from investigator, therapist, clinical manager, and director. She has experience in program development and has specialized in substance abuse treatment during her career. Aimee is married. She and her husband have 2 active children in the Otsego School District. And the title of Aimee's presentation tonight is Promoting Community Well-Being, Wood County's Approach to Mental Health.
Thank you so much. Okay, so I admittedly am not the best at technology, but I muddle through. So I just want to put that disclaimer out there. If my kids were here, they could probably run circles around me. So, all right. So I think I'm going to try and share my screen now, if
I've
that's okay.
gotta get you as my
Okay.
host. I can't find you here. Oh, never mind. Here you. I'm looking for the name and it comes up as Wood
Oh.
County, ADAMHS, of course. I like it. That's
I
why.
probably should change that.
Make,
It'd be good for everybody to mute until you're ready to speak. We're getting background noises.
yeah, that does help. Thank you, Lee. And I'm gonna let somebody else in here. I don't know who it is. MSTFE. I don't know who that is. We'll find out.
I think that's Martha.
Well, maybe it is.
Hello.
Oh, Martha Feather, maybe.
Yes, it's me.
Okay, good. Welcome. Another one of our committee members. Thank you.
Oops, what happened here?
And we're just ready. We just introduced Aimee and she's about to do her presentation.
All right. I'm going to try to share my screen now. So it says host disabled participant screen sharing.
I disabled it.
That's what it says.
I didn't mean to do that. Let's see. Oh, shoot. Oh,
We'll get it.
let me reclaim host a minute.
Okay. Yep. It says you're the host now.
Yeah, I just did that. Now I got to figure out whether I was supposed to also give you screen sharing capabilities at that point. I thought,
I think so. Yes.
it says make host. It doesn't really say about screen sharing.
Well, maybe if you try making host, maybe that'll work.
Well, that's what I did try to do. Maybe I didn't press the button well.
It says
Now
I'm
you're
the
host.
host now. I'm the host. Let me try it. Oh, it looks like I can.
Okay, I must not have gotten the button pushed right to make you actual host. I thought I did. Okay.
All right, so I'm gonna share my screen. So my apologies, you get to see my beautiful daughter for a second.
Cute with her animals.
Yes, we raise bunnies, and that's one of her many bunnies. All right, so I just want to acknowledge that we did try to pull this off back. I looked at the original flyer. Wow, March 31st.
Yeah, just before.
Yeah.
Going to do it. The library closed just before that, and that was the end.
And obviously here we are in October. It doesn't seem possible. And in 1 minute, it feels like the blink of an eye, and the next it feels like an eternity. So I'm sure everyone else probably relates to that. But so yeah, here we are several months later. We finally get to do this, maybe a little differently than normal, but that's okay. So I just want to say a special thank you to a couple people. Obviously, the League of Women Voters for hosting me. I really do appreciate the opportunity to come and speak, be here and speak. And obviously, the Mental Health Committee specifically, and also Todd for developing the flyer. So, which I thought were really, really nice. So had some very nice graphics.
He did it for us, which was also very nice.
Yeah. So those are my thank yous. Hopefully I'm not leaving anyone out. And then of course I've got on there how important it is to vote 2020. So that's a big message right now, right?
Oh yeah.
So and I actually had to remember to register to vote this year because we actually moved. So that was important for me to do, and I did get that done. So as we mentioned, my title is Director of Community Programs at the Wood County ADAMHS Board. A little bit about what I do is I oversee the Addiction Task Force, the Suicide Prevention Coalition, and community trainings, community events, help with our marketing perspective, just a little bit about everything. We're pretty small staff, and I'm going to talk to you a little bit about who we are and kind of what we do, because I would imagine there's some people on this Zoom call that probably don't know much about us. So I like to try and provide some education as well. If you don't know where we're located, we're off of Haskins Road. We've been there for quite some time. This might look more familiar. This is actually the street view. And I find that people can kind of relate to this a little bit better, more so than the front of our office here. Can you all see my screen? Okay, good. So that's where we're located. We're kind of doing a hybrid model for our office right now, as many people are. We're not all in the office all on the same day, where many of us, work from home and kind of stagger our availability just so that we're not contributing to the spread of COVID. So, but we are available, by email, phone, all of that good stuff. So even when we're not in the office. All right. So who is the ADAMHS board? And some of you can probably answer this very easily. Got to move you guys over. Sorry about that. So under Ohio law, we're one of 50 boards. I know there's more counties than that, but some boards encompass multiple counties that coordinate public mental health and addiction treatment and recovery in Ohio. So under what's called Ohio Law 340, we basically plan, fund, and evaluate mental health and addiction treatment and services. So what we are is a quasi-independent part of county government. So we are part of a county government, but we're kind of like a little offshoot because we have our own board of directors. We call it our board, and I'll talk to you a little bit about that. So this just kind of shows you, and I don't expect you to memorize this, but this just shows you down in the lower left-hand corner where the arrow is. We are a part of Wood County government, but we're listed under boards and commissions. So we are a small part of the county government as well. So just to be clear, we don't actually provide any behavioral health services. We're actually prohibited by law to provide services. So even though myself and two other office staff are licensed clinicians, licensed therapists, we are not allowed to provide services. We contract with our providers to be able to do that. So we do have two licensed professionals, myself and Chris Stridell, that actually go into the agencies and do audits. Chris does a lot of client grievances. So if there's a community member that has a concern about an agency, they would contact us and we would help resolve that. Let's see. So basically, we're doing anything, we're contracting anything from prevention services to crisis services to treatment services. And we have a variety of providers that we work with in the community. But we do work with a lot of individuals that we necessarily don't contract with, but courts, university, the prosecutor's office, specifically the ARC program, the public defenders, probation, and many other state and county officials, because a lot of what we're doing is developing good plans and following through and making sure that there aren't any snags along the way. So this just has our mission. So our mission is to plan, fund, develop, fund, manage, and evaluate community-based mental health and addiction prevention, treatment, and recovery to help improve the lives of the citizens of Wood County. It's a pretty lofty goal, right? We obviously have some pretty big jobs, some pretty important jobs, but we, the staff members, aren't necessarily the decision makers. We have a board, like I mentioned before, of up to 18 residents that make up our board. And so they're the ones that are voting on decisions that affect the community, whether or not we're funding programs and kind of what we're doing in the community. So I did list our website there, which has a ton of information about our board. It lists minutes from our board meetings. Anything you'd possibly want to know would be listed there at our website. And then obviously we have a Facebook page too, which we update pretty regularly. So just to kind of give you an idea, we are a small staff. So you can see we have an executive director who is underneath our board, and her name is Deanna Stanton, and she's been with us for about a year now. So many of you might remember Tom Clemens, and he has since retired and has been replaced by Deanna. So she has been busy getting her feet wet and learning all about what we do. And then underneath that, you have the staff that are in the office. Myself as the Director of Community Programs, Chris Stridall as the Director of Quality Improvement, Julie Launstein as our Director of Finance. We have a data coordinator, which is Cheryl Critton. She's been there a very long time, over 20 some years. She's getting ready to retire. We have an office administration coordinator, which is Brittany Fackler. And then our secretary is Catherine Shackleton. So we are a pretty small staff. But we have up to 18 board members. So
You
10
mentioned
of those,
Tom Clemens,
Yeah.
and we had actually met with Tom at least 3 times over the years in the process of getting our position statement together and getting all the education and knowing who to talk to with his help too.
Yes, Tom, you know, I've known Tom for a really long time, way before I actually started. He helps kind of recruit me to come to the board as a staff member. Brilliant, you know, brilliant guy. And I hope he's doing great in retirement. So we sure do miss him.
He was looking forward to it.
Yeah, I know he was. He deserves to. He deserves to. So, so our appointments for our board members actually can come from 2 places. The Wood County Commissioners make appointments, and then as well as ADAMHS, or the Ohio Mental Health and Addiction Services, which is kind of our state organization. So we get appointments from both, and individuals can serve for 4 years, a total of 2 terms, so 8 years total. So it's kind of a rather long commitment, and I would say the first year or 2 are probably people learning, especially lay individuals, lay people, kind of about what we do and stuff. So we certainly appreciate everything they do. They you know, are not paid, so they are volunteers. When we're very grateful for them. So our laws actually require that we have certain people on our board. That includes some examples, like we need a mental health professional, someone that is actually receiving services, behavioral health services, someone who specializes in the treatment of drug and alcohol addiction. So we actually, it can't just be anyone from the community. We do have some just kind of general appointments, but most generally we have individuals that kind of fill a certain role, because we want to make sure that everyone is well representative and that we're making the best decisions. And you have to have the right people in place to be able to do that for sure. Okay, so some of you folks may know some of these individuals. These are our current board members, just kind of what their designation is. We also have certain roles like our board chair who runs our meetings. And then we have, you know, a board secretary and a board treasurer, things like that. So if you see these individuals in the community, thank them for their service. We do appreciate them, but we're always looking for new board members. I believe we have 1 opening at the moment. So if anybody finds in their heart that this is a passion for them, we'd love to hear from you. A lot of times people reach directly out to us, and we kind of help them through that process, especially when it's ADAMHS appointments. So does anybody have any questions about our board or board members? All right, so just want to remind everyone, our board meetings are open to the public, and I know we have a couple members of the media here tonight, and sometimes they do come to those meetings as well. This just kind of explains a little bit about when our meetings are typically held. We have one coming up, I believe the 26th. That's a full board meeting in October. So right now, I'm sure it's no shock to all of you that we are doing this through Zoom. And because these are public meetings, we are actually broadcasting them through what's called Facebook Live. So anyone from the community can watch these meetings, you know, and then anyone we need to actually attend, we invite through Zoom. So that's kind of what we're doing right now at the moment. Hopefully it won't be like that forever. But as we all know, we've had to make some concessions along the way. A little bit about where our funding comes from, and I certainly am not the expert in this. I'm not our finance director, but I try to keep up with her if I can. She's a pretty smart lady. Her name is Julie, like I mentioned. But a bulk, just so everyone knows, a bulk of where our funding comes from is actually through levy funds. And the League of Women Voters has been a strong advocate, I know, in the past when we do have levies on the ballot. We don't have anything currently, but obviously that is where a lot of our funding does come from. We get some from federal, and we do get a small portion from the state as well, but the bulk is local. So we would not be able to do the many things that I'm going to talk about here throughout the presentation without all of your support. So really the big shout out and the thank you should go to the taxpayers, because without all of you, we wouldn't be able to do what we do. So
We did support the levy the last 2 years ago, whenever it was.
yes,
We wrote a letter.
yes, it was very nice, and again very much appreciated. So as you can see, we have a lot of individuals and agencies that we contract with, and I'm certainly not going to go over all of these, but just so you can kind of get an understanding, we do work with a lot of different entities to make sure that the needs and the services are available to people that are in need, so of any of those behavioral health services. So hopefully you don't have too many questions on this, because I'm going to tell you my knowledge of all of those expenses probably ends there. So as we mentioned earlier, I have a degree in counseling and criminal justice, and definitely not finance. These are some of the main agencies that we do work with, not all by any stretch, but some of the main agencies in the county. Some of these are very familiar to many of you. You know, Harbor, Unison, Renewed Mind, NAMI, CRC, and the Wood County ESC, which they provide a bulk of our prevention services, if anyone's not familiar with them. So, but we do have other agencies that we do need a contract with, certain hospitals and other people outside of these specific agencies. So I want to talk to you a little bit about marketing and awareness during COVID-19 and beyond. So some of this is obviously an ongoing effort, but some of it has been kind of pumped up because of the stressors that are involved with the current pandemic. So just to kind of let you know what our kind of goals are for the year. So obviously to increase and continue that community, educating the community about our service providers and kind of what we do and what's available and how to get help. And building relationships, that's really important. Like this relationship tonight, you know, we want to make sure that people feel comfortable reaching out to us if they ever have questions or need anything. And obviously getting that information out there as much as we can, because you know, you never know when people might need that information in a crisis. So I want to start off by acknowledging that we've had to cancel events. Unfortunately, there are just some events that we haven't been able to be a part of this year because of the pandemic, and I'm sure everybody understands and relates. One of the big ones that was the first time as ADAMHS was partnering with the prosecutor's office was actually, if anyone recognizes this is the Youth Olympics. So this was actually the logo. I didn't create the logo, but I kind of morphed it to say 2020 and had, you know, it was super exciting. And this was supposed to happen in March. And it didn't happen. And it's, it's a real shame because this was, one of those positive community involvements with young people. So specifically 4th and 5th graders in the county, and just making sure that they have a place to come and compete in a non-competitive kind of environment and learn about what our services are. So we were pretty upset, probably me the most, because I did a lot of work with this, and it was canceled days before it was to happen in March. So, but just to give you kind of an idea of some of the things that we've had to unfortunately cancel, but we've continued on with some really good things too. So one of those things is the podcast project. So it's actually called Stigma Busters. And the goal is basically to provide a media outlet for our clinicians, so therapists and social workers, to be heard in the community, and share their kind of stigma busting myths on mental illness, as well as available options for therapy, resources, self-care tips. So we're going to get this underway in January 2021. This has been a big project. So I want to thank specifically Courtney Rice from NAMI. She's our marketing director at NAMI. So she's been doing a lot of work with this, and we're pretty excited that we're going to have this available in just a couple months.
Have the schools been involved understanding the podcast and getting the words out to their communities?
So you mean like the schools having their own podcast, or like
No,
us?
well, the podcast that you have there.
So
Just
we haven't started marketing that a whole lot
okay.
yet, just because it's not till January. But certainly when it gets a little closer, we plan to do that.
Okay.
And the reason being is that we've kind of learned if you market too far in advance, people kind of
Yeah.
forget
Yeah.
about it. So, but yeah, that'll definitely be, I'll even make a note of that to make sure that we're getting that resource out as well. So the schools, and I don't know if all the schools, I can only speak for the school district that my kids are in, have been really great about sending out mental health resources kind of on that weekly newsletter. So that could be a good resource that we can, maybe let them know about the podcast. All right, great question. All right, so what we're trying to do is have some themes for each quarter, because we're on a fiscal year. So our new fiscal year started in July. So our one that ran until September 25th was mental health is as important as physical health. And we really believe that. And we thought during the time of COVID, this was a really important message. So right now we are in the You're Not Alone, because a lot of people do feel very lonely, and we'll talk about that more. And then we've got While You Wait and Remove the Mask. So more to come on those. We're also, continuing to write articles to Wood County newspapers. Courtney's been busy doing some of that. I also have a Vista. If anyone's familiar with AmeriCorps, we have a full-time AmeriCorps Vista position that's actually helping with some of these marketing tasks. Her name is Kaylee Molman, and she just started with us just a couple months ago. And so she's been working on some of these things as well. She's been busy creating social media posts. We're pretty active on most every social media platform. Facebook, Instagram, Twitter, LinkedIn, anything you can possibly think of. I can't possibly even keep up with all of those. But we do post regularly to all of them, because we know that not everyone follows the same, social media platform.
Can I ask a question about that?
Absolutely.
The quarterly themes, is that all you do with them, is post on social media?
A lot of the themes is based around social media. So we'll post specific posts and information about those themes on our social media. Yeah, but we're always open to ideas if you've got some on ways that we can get that out.
People like me would never see them.
Okay. Yeah, we do know that not everybody is on social media. So we try to get some information, and I'm going to show you, actually, I'll go ahead and skip ahead. These are some of the ads that we run in other areas, because we realize that not everybody is on social media or has access to social media. So as you guys can see, these are some ads. The one on the left was the at-home shopper in Wood County, and that's a pretty popular one, has a lot of information that was sent out to, I think, all Wood County residents in September. So we had a pretty nice, I believe it was a full page ad, if I remember correctly, that was in there. And that was a way to do the "You Are Not Alone." So that was another way that we did get that message out, besides just social media. And then another, Healthy Living News, if anyone saw that, that's a print platform. That was something else that came out in August. So those are some, we do try to do some print. You know, we try to mix it up as much as we can. Hopefully that answers your question. So here's some other ones. I hope that you guys have been able to see some of them. These were specific to social media. So the last ones I just showed you were some of our print campaigns. And these are specific ones. We do pay to boost them. And if anyone's familiar, so we don't necessarily just put them on Facebook. We actually pay to have them boosted for Wood County residents, so that more people are seeing them, and not just people that would happen upon our page or something like that. So that's kind of a nice feature. I have noticed that a lot of times I get a lot of them. I see them over and over again. So I think that's really, really great. Again, promoting the "You Are Not Alone," which was our most recent campaign, and the National Suicide Prevention Week. We obviously had something promoting that as well.
Are you doing any television spots?
Yeah, so we do some television spots, and I actually have a couple of them to share with you. We've done them some on like local stations and cable and things like that. And I'll share some of the ads that I've run a little bit later.
Okay.
Another thing, we're just calling it Project Reconvene. Some of the things that we're doing is we've noticed, we've kind of kept tabs on some of the services that have been underutilized in our county. So for instance, the ACT team at Unison, which is a specialized service, we have been meeting with kind of the managers and directors of those programs and doing like an interview, and we're going to get those out. That just happened in the last couple of weeks. So those will be sent out to the Wood County community, and especially our clinicians. So, because sometimes not even our clinicians know about all the services that different agencies can provide. So, so here, like I said, we had some, sorry, got to go back. Some specific TV ads. The first one wasn't actually a TV ad. This was more a boosted post, but I will show it to you because I thought it was a good one. Hopefully this works. Can everybody see that?
Mhm.
Yeah.
Yep.
So that was one of the educational pieces that we had made in regards to how to help someone that's struggling with suicide. So hopefully you guys found that informational as well, and kind of how do you respond to someone that could potentially be suicidal. I think I might go on to the next YouTube video here. Hopefully not. But that was one example of something that we had made. And then I'm going to show you some additional television spots that we had made. And these were all done by local Wood County citizens. So these are kind of, your friends and neighbors that did this. So this is not paid actors or anything like that. So I'm going to share a couple of those. To go back here. Now it worked the first time. Maybe I'll have to do a cut and paste. Oh, no. I wonder why it's not working. Let me try the next one. Yep.
Well, I've seen this one.
So I don't know if anybody recognizes some of those individuals. I'm going to share at least one more, if that's
We
okay.
didn't get sound on that. Amy.
Oh, no sound?
No.
Oh,
but
no.
I've seen that one on television, that particular one.
Okay. Well, I won't necessarily go through all of them. They are all on YouTube. They all feature, like I said, Wood County residents that have specifically lost someone to suicide. We felt that was really important so that people recognize that this is a problem that Wood County experiences this kind of loss. So feel free if anybody would like these. Don't feel like you have to frantically jot them down. I will share my email address at the end, and you can always email me and I'd be happy to send them to you. So, and even if you get on YouTube and Google Wood County suicide prevention videos, you might even be able to come up with them. So I'm sorry the sound didn't work. Again, sometimes technology doesn't always get along with me. But at least you guys were able to see the video, correct?
Yes.
Okay. All right. So my apologies on the sound. Okay, so I wanted to talk a little bit about special populations in COVID, a little bit about kind of what we've been doing to kind of recognize that certain individuals or groups of individuals are struggling. We certainly aren't able to capture everyone, but we've done our best, and I just want to at least highlight some of those activities. One of the things that the Suicide Coalition, which is one of the organizations that I do as part of my position, we actually sent out letters and provided ear pods. So if anyone's familiar, I don't have one on me, but basically with a lot of people going online or people needing a way to unplug and relax with meditation or music, we provided all of our healthcare workers with these ear pods that actually have the HOPE logo that you guys can see there. And that's the Wood County Suicide Prevention Coalition logo. And then we also provided, this is an example of one of our letters. So this one was specifically for, I'm trying to read it real quick because I just kind of grabbed one. So, we sent it to, or we provided it for Wood County emergency room employees. We provided it to our nursing home workers, from everybody, from the nurses to, all the staff. We provided it to our behavioral health care workers. So anybody that we just felt that could be at additional risk, because when COVID first hit, we obviously saw and were concerned about some surges in our nursing homes, in our extended care facilities, in our hospitals. So we wanted to make sure that those individuals that work in those environments at least knew about the resources. So we provided them with the Wood County Crisis Line, the 211, the crisis text line, those kinds of resources. So, and those were spread, we ordered several thousand, and they were spread pretty widely across the county.
It's impressive. You've done.
Thanks. It was actually in the midst, I had just broken my leg and torn 3 ligaments in my knee. And so I wasn't able to drive. So I had to rely on other people to help me get them out. So I do appreciate that. It was a stressful situation. So, but we got them out. Another thing that's going on, another movement that's going on, is just to keep with the healthcare theme, is there is a phone number. It started on April 6th. And basically that we're calling it the Ohio Hero Line. Anyone that works in healthcare can actually call and talk to a peer if they're struggling. So if they're struggling with kind of what's going on and their day-to-day, this is something that they can reach out. And we provided funds to help support this. We did it in conjunction with the Lucas County ADAMHS board. So the Wood and Lucas County both went through the ZEF Center since they had agreed to do that. And so this is the advertisement for that. So basically they can get those services if they're struggling, during COVID. So it's got the phone number there if anyone needs that. And then I wanted to share this. It's just a kind of I won't necessarily show you the whole thing, but this was a thank you that all the ADAMHS board executive directors, they made a video that was sent out to the healthcare workers, behavioral healthcare workers specifically, kind of thanking them. So this is, well, you probably can't hear the sound, but I'll do my best. Can you hear sound? No.
No.
Okay, well, so basically this is about 2.5, 3-minute video that really just kind of shows how much the directors really appreciate everything that's been happening.
Nice.
Now I got to figure out how to turn it off.
Yes, you can turn it on.
My apologies. The music was quite loud on my end. Too bad you guys couldn't hear, but it's very nice music. Okay, so back to our PowerPoint here. All right.
That's so fun.
Okay. Go back here. Oops. Sorry about that. So that was a little bit about behavioral healthcare workers. Another thing that we have tried to focus on as far as special populations is our first responders. So they have been under a great deal of stress, especially with the COVID pandemic. So we, as part of what's called the Week of Appreciation, we held some trainings, some self-care trainings, webinars in September. And basically this is the kind of like advertisement that we had made up. So we had 3 different sessions that they could attend. We tried to make them at different times because we know that first line responders often don't work standard shifts. So we had one on coping with stress, the silent enemy of first responders during the pandemic. So strategies based on real life experience from experts. So we had a panel of experts to talk about their experience. And then we had, this was all just very recent. So on September 23rd, we had a self-care for first responders, Help for the Heroes is what we called it. And then to end that week, we had local resources for frontline workers caring for our caregivers. So we're continuing to push those out, even though obviously they were a live event. We recorded them and they are being sent out so that our frontline responders can watch those when it's convenient for them and they can get some additional resources and help. So another thing that we've continued to do, and this has been an ongoing thing. So myself and Angela Patchen, if anyone knows who Angie is, from the ESC, we're the co-chairs of the Suicide Prevention Coalition. We have switched our what's called QPR trainings, which is question, persuade, and refer. It's a suicide prevention training. We've actually switched it online and we've started to market that to teachers. We have heard recently, unfortunately, around the state of Ohio, there's been some teacher suicides. And so we wanted to specifically reach out and provide support so that teachers might be able to recognize it in their peers. For those that are, bless you, online or also, in the schools and teaching. So we have started to push that out to our teachers, and we have done a few online trainings as opposed to in person. So, and those are something that Angie and I can provide to any group. So if that's an interest, we're happy to do that for any group. It doesn't have to be just for teachers. Kind of another special population, we've certainly been concerned about our students. We had we participated in what was a virtual health fair. We provided some social media and some different resources that were available. So one of the things that was available to students to watch was this short video. And even though it's a video of myself and our director kind of talking about what our services are, I would like to share that with you if that's okay. It's a couple minutes long. I'm going to see if there's a way that I can turn on video this time though. Wish me luck. So if I turn up. Can you guys hear that at all?
No.
No. I think if you're trying to do it through your computer, that might be why it's not working. I've tried to play music that way for a group, and I end up having to do it with a special speaker on my desk. I'm not sure if that's your problem, but I know that's what I found out when I thought I could do it right through my computer. It didn't work for me.
And I will tell you, when I kind of do a dry run on a presentation, you don't know those things.
Not unless you got somebody else listening.
So my apologies. We'll move on. We won't play any more videos. All right. But basically it was alerting students on campus, because sometimes, they're new to the area, might not know about what services are available. Obviously they have the BJSU Counseling Center, but wanted to make sure that they knew about additional services that they could access. So some of our at-risk groups, this is just an example, we've continued on, some of it's been virtual. Our Survivors of Suicide Loss Support Group, that has continued on, and we are actually in development of an additional support group for individuals that have attempted suicide. and survived. So we are actually receiving a proposal here, I think at the end of the this week or next week, and we hope to have that group up and running the beginning of 2021. So we're, continuing to recognize that more support groups are needed, and want to support those individuals that might be at greater risk. So switching gears a little bit, I know I'll just ask, is there any questions about kind of like what we're doing to address special populations, or kind of how we're trying to outreach during this pandemic? Does anybody have any questions?
I'm impressed with how many things you've got up and going in this short period of time when you weren't even planning for a COVID.
Definitely not planning, I will tell you. It's been a challenge. So, but thank you. Yeah, we're trying to, and we're always open to ideas. Actually, I just got a really great idea. I don't know if anyone here has heard about geocaching. But basically it's where you go out and look for trinkets and things. And what we thought we could do is provide resources and like little, tchotchke things from the ADAMHS board where people could, still socially distance, but go out, and look for those kind of items. So we're always looking for new ideas to try to get the community involved. That one's brand new idea. So we're working on that. So, but thank you. So I wanted to switch gears a little bit because I was asked to talk about crisis services as well. And some of you might know the history. For many, many years, we actually had what was called the Link. And that was a brick building that was provided by what was then Behavioral Connections and is now Harbor. And that structure, actually, I don't even think it exists anymore. But we have moved to a slightly different platform here in the last couple of years. So we actually contract with Unison for our crisis services for the county now. So basically anyone that's in need of 24/7 crisis service, there is a phone number to call, and I'm going to share that here in a minute. Oops, there it is. 419-502-HOPE. So that's 4673. And how that kind of operates, I wanted to explain that a little bit, is actually through a company that's called Protocol. And Protocol receives the calls, and they are a US-based organization that staffs behavioral health specialists. And they answer the call and they screen that call to see if it needs a higher level of attention. And if it does, then Protocol actually reaches out to Unison, and Unison can go on scene and do what's called a pre-screen and do crisis services and intervene on behalf of that individual that might be struggling. So it is a little different than what we've had for many years in the county, and I wanted to make sure everybody was kind of aware that we had switched. This is the information on Unison's website about their crisis services. So I thought it was a really nice kind of tribute. It also mentions us and kind of explains what, when you should call that number and utilize those services. So I wanted to share a little bit of information about the utilization of Protocol and those crisis services. So the number of phone calls, as you can see, I have dating back from March of 2019 through August of 2020. Unfortunately, I don't have September and obviously not October's yet. So sometimes we're delayed a little while, but as you can see, we have had a couple big spikes in recent times. Most notably, I would say June. We had quite a big spike, but this kind of gives people an idea of the number of calls that are directly coming into our crisis line.
Well, they got tired. I mean,
yeah.
So people are not knowing what to do anymore. It keeps going on when they thought it was going to end.
Yep. So, I apologize. I want to take a drink real quick. I've done a lot of talking.
Yes.
So this just kind of shows the spike up close a little bit more, but obviously we've had those spikes. So this shows the actual number of what's called pre-screens versus diversions, and diversions would just be like when a safety plan was utilized instead of actually having to hospitalize an individual. So this is kind of showing, I'm gonna move you guys around here. Again, from March of 2019 through September of 2020. So we've had some, ebbs and flows. Obviously the calls, it kind of shows that in some ways that protocol is kind of able to problem solve some of those calls without necessarily it being a pre-screen or a hospitalization or even a safety plan. So that's just giving you some information there. I'm gonna go back for a second here. So I wanted to share this because I wanted to make sure that everybody knew this is not just a new problem. This specifically says, I want to read it because I find it very poignant. A new report by the Ohio Alliance for Innovation and Population Health reveals that drug overdoses, suicides, and alcohol-related liver disease, or we call them deaths of despair, rose in Ohio over the last decade, taking 1.9 million years of life. From 2010 through 2019, so-called diseases of despair killed 53,632 people in the state. So my reason for sharing that is this isn't new, unfortunately. These problems are not new. They've been around and been a significant concern for all of us for some time. I certainly don't want to diminish the impact that COVID has had, certainly been a big one. But unfortunately, these deaths of despair, as you can see over the last 10 years, have been significant. So hopefully that's not too much of a downer on our night, but it is something I like to make sure I point out to people. But this is kind of what we're dealing with in the moment, and that's the struggle to balance literal survival with all the things that make surviving worthwhile has never been so clear. With the COVID-19 pandemic forcing many to sacrifice social connections and therefore quality of life for life itself. And yet, as I wrote in a recent health affairs policy brief, social isolation and health, being socially connected in meaningful ways is actually key to human health and survival. So I share that because we already have these deaths of despair. And unfortunately, when you have social isolation and social disconnectedness because of a pandemic, you certainly are increasing those deaths of despair and increasing those concerns. So I wanted to kind of, answer any questions you guys might have about that. I certainly do not pretend to have all the answers. Unfortunately, to be perfectly frank, we won't necessarily know about all the impact that COVID has had on our mental health until the crisis is over. We certainly know some, but we learn more each and every day. And unfortunately, sometimes we just have to learn, kind of as we go. So does this make sense to everyone?
Yep.
Yeah. They're not new problems, unfortunately. They're just made worse by what's going on. So that's, yeah.
It was interesting this morning, Aimee. I heard a short bit on the Today Show, and they were talking about that there is definitely a mental health crisis in America. And yet they said at the end of their little spot, 70% of people still feel hopeful. And that's encouraging.
That is encouraging.
That number is at all accurate.
Yep. No, that's great to hear. I love positive news.
Yeah. Because
So obviously, you know, our government is aware of the mental health crisis that is occurring in America. Some of you guys may have heard about the CARES Act, and some of that money helps specifically with behavioral health services. But there is some money being funneled from the federal government to assist our providers, because some of them have been really hit hard by the economic impact. So we certainly don't want to lose our providers in a time where people might need them most. So another service I wanted to point out, it's not necessarily that something that we run here on a local level, but it is something that we actually help promote and pretty heavily at times, and that's the crisis text line. So I talked to you guys about the Unison's crisis line, which is a phone number that you call the 502-HOPE, but this is actually a crisis text line. So it's a nationwide text line, but there's specific data they can collect when people from Ohio are texting. So they have certainly seen an increase in those conversations. Obviously, anxiety and stress, probably no shocker, are kind of leading the forefront as far as what people are texting in about. That phone number, if anyone ever would like to use it or spread that message, it's 741-741, and you can just type for HOPE. So, and actually you can type just about anything, they still answer. So, and they're trained volunteers. They're not necessarily behavioral health specialists, but they're trained volunteers that are answering those texts. And we know that young people today do feel sometimes more comfortable texting versus talking on the phone. I know me personally, and that just might be because I'm over 40, I prefer sometimes to pick up the phone and call. And that works for some people. And then there are other individuals that just feel more comfortable texting. So that this is an advertisement for the crisis text line, and we've put that pretty heavily on different ads. We've even had window clings made. Before the pandemic hit, we were putting them on mirrors in bars, windows of businesses, you know, obviously social media, print. So we were really trying to get that message out there as well. This is some stats specifically from the crisis text line. This just kind of shows where Ohio is at with our concerns versus nationally. We're pretty neck and neck with, you know, some of the national trends. And this has actually changed quite some since COVID hit, but before COVID, depression was the #1 reason that people would contact the crisis text line. Right now, it's anxiety and stress. Since the pandemic, the crisis text line has actually seen a 49 times growth for any conversations mentioning virus. So people are specifically calling in about the virus, the coronavirus. That is a big concern for people. So they are utilizing the resources when they need them. So I would be remiss if I didn't mention that we kind of have some crises that arise or have arisen as a result of quarantines and people isolating. And that's specifically around domestic violence, sexual abuse, and substance use. So as you could imagine, with, you know, people working from home more, or kids not being in school, teachers not being able to report concerns, people having less contact with just other people to be able to notice a concern, we are seeing a rise. And we have been working with the Cocoon, which is our domestic violence program and shelter here in Bowling Green, to help support them as well, because they've seen huge numbers of individuals needing their services. So we've been working with them as well. So those are, you know, crises that we're seeing as a result of the pandemic as well. This is specific to the crisis text line. In regards to the one on the left is the domestic violence conversations that they've had, and how they've gone up. So you can kind of see in print, you know, from December of 2019, they averaged around, I would say 1,700, 1,800 calls per week. Up as in May of 20, we are at about 2,500 calls per week. So the number of calls specific to domestic violence certainly have gone up. And then the sexual abuse conversations that are texted about have gone up as well. And that is on the right-hand side. And then kind of my specialty and what I have worked so closely in my career is, oops, sorry about that, is specific to substance abuse. And unfortunately, it looks like this one was supposed to be substance abuse, and unfortunately, it looks like it recopied the sexual abuse one. But as you can imagine, it looks very similar to this. So my apologies, I'm not sure what happened there, but we are seeing many, many increases in overdose deaths. Just to kind of give you a little bit of a local flavor, we do get stats from the Vital Statistics Registrar at the Health Department, Health District. So we obviously continue to have some suicides. We had one confirmed in August. I will tell you that sometimes the coroner reports are a little delayed. So year to date, we've actually had 11, or 10, I'm sorry. We had 11 in 2019 total. And then substance abuse deaths, in August we had 2, and then year to date we've actually had 19. So those are some of our local statistics. And just something that I want people to keep kind of on their radar, you know, the first wave of the pandemic was that, you know, anxiety and stress. And the second wave, we've worried about obviously domestic violence and sexual abuse and all those other things. And obviously, we need to worry about kind of wave number 3, and that's, you know, the job loss and the grief and the racism that we have experienced as a country. And obviously, all those things affect individuals' mental health. So we are certainly trying to see what we can do to get ahead of those issues.
Aimee, have they done anything with telehealth?
Yes.
That was
So
mentioned this morning as something that's helping.
Yep. So many of our providers, especially when the coronavirus first hit, went exclusively to telehealth. And a lot of them are doing a hybrid model right now. So they're all a little different, but many of them, you can either do a telehealth visit or you can actually come to the office. So depending on kind of the service that you're looking for, those are available. And I will tell you, the silver lining of, if there is one, of a pandemic, is that we have made available telehealth services much quicker than we would have otherwise. And I will tell you, it has been a lifesaver for many individuals that previously struggled to get into treatment with transportation issues and other things that, you know, might be difficult for them. So I will tell you that has been a positive thing, where people that weren't able to access services before can now access those services. So that puts a smile.
Is there any issue with insurance covering telehealth? I've heard some stories to that effect.
Yeah, so every insurance provider is different and unique, obviously, and I can't speak to all of them, but I can give you, for instance, Wood County. I know as a county employee, I carry their health insurance, and they've made exceptions to telehealth during this time. So each and every, you know, insurance carrier obviously is a little different, but most of them, including Medicaid and all of the higher level Ohio providers, have really consented and said, yeah, we're going to need to do this and pay for these services. So that's been a good thing. And
Amy,
then of course, we're available to help pay for any services that aren't covered. So
I've lived in Bowling Green a long, long time and started with the link, and I'm just astounded to see how this has grown, how it's become so all encompassing, and with for so many people and so many different organizations, and how it's spread out. I wondered about the phone numbers. When I call 211, how can, if a person doesn't know all of these phone numbers, and if they call 211, can they be connected to the one that they mostly need, to the services and to those organizations that will help them?
yep, absolutely. I do agree that it's a lot of phone numbers sometimes to remember. 211's an easy one, and they have what's called a warm handoff. So they can refer, if someone calls 211 and says, I need help with XYZ service,
Yeah.
they can provide that warm handoff and connect them.
Ah,
So 211 is a resource, and I pulled it up here. It was one of my slides actually. So I pulled it up. That is definitely a possibility. The other thing is, if people are comfortable, a lot of these phone numbers are actually listed at our website. So I'm going to access that really quickly just to kind of show.
yeah, so people should memorize that website.
Yeah, definitely not memorize it, but this is part of the Wood County ADAMHS website, and this is specific to addiction treatment. So it's got all the phone numbers and everything that anyone could possibly need. And this can be accessed on their phone. It can be accessed on their computer. Obviously 211 is a great resource too. I'm not trying to diminish that by any means, but there are lots of ways to kind of get the information out there.
Great, thank you.
You're welcome. And I know we're kind of getting close to our time. I wanted to try and be done with my presentation around 8:30, just in case there were questions, but I have a couple more slides I just want to point out. So I kind of skipped ahead. Got to go back here. All right. So like I mentioned, the Wood County ADAMHS website, and then there's one specific for resources for depression and suicide, as well as the opiate and other addictions. So make sure you check that out. We mentioned 211. The Addiction Task Force is another way that we're continuing to reach out to the community. That's something that I actually am a co-chair of. There's actually 3 of us. Mylan Karna and Kyle Clark from the ESC are the other 2 co-chairs. And we meet regularly with community members and providers to make sure that we are staying abreast of any substance abuse issues that are happening in our community. I think I actually did better than I thought, getting close to the end about the time frame. So I guess kind of this is one of my messages, people are definitely struggling in our community. And a lot of times people ask me, well, what can I do? How can I help? And really the easiest and most effective way is just to be kind. And that goes a long way and I know that sounds so easy. And as a therapist, I can tell all of you and the community that you don't have to be a therapist to be therapeutic. Certainly kind words when someone's struggling can mean everything. So I am available at any point by email. So my email is ACOE@WC, and that's for Wood County ADAMH.org. Anytime you have any questions or might need some resources, I'm certainly able to provide those as our community person. So what kinds of questions do you all have for me?
Have one. I'm not clear on your relationship to the organizations you support. You give them money, you promote them. Do you oversee what they do?
Yes. Hang on, let me get my PowerPoint to stop sharing here. My apologies. Maybe.
Should be up at the top somewhere, Amy, maybe? Where it
Oh,
says
I
stop
see it.
sharing.
Thank you.
Yeah.
Okay.
I always have trouble finding that too when I'm doing it.
Yeah. So one of the things that we do is we actually provide clinical oversight. So myself or Chris Streidel actually go in and clinically audit the agencies. So if they're billing us for specific services, we go in, we obviously pick at random, we can't audit every service. We pick at random services and we go in, read the notes, make sure they were clinically appropriate, that they provided the service that they said they did. And we provide technical assistance. So if an agency is struggling with a specific service, how to implement a new program, that's actually something that we can work with them on and help them get that running. So a lot of times we work really directly with our agencies. Anytime they have questions or concerns, or there's new resources from the state, things like that. So I hope that answers your question. But yeah, we work with them pretty closely, not only promoting them, but overseeing them. We provide that financial and clinical oversight.
If I know absolutely nothing about ADAMHS and want to start to look for services, go out on the internet, what do I look for?
So I would say our webpage is probably the best place to start.
How
And
would I
that-
be able to go there? That's my question.
So a lot of so Google searches, and the way that I kind of have learned about Google searches is that when people put in certain words, like Wood County or mental health, our website will actually pop up. We can kind of get our website rated a little bit higher on certain searches. So even if someone doesn't know Wood County ADAMHS, they've never even heard of us, don't know anything about us, if they put in Wood County mental health or mental health near me, a lot of times those kinds of searches will actually produce our website.
Thank you.
That's a great question. I've tried it a few times. I've been pretty lucky. I usually get our website.
Amy, you talked about getting statistics from the health department. What is your relationship to the health department other than that?
So we work, the health department actually does what's called I think it's called a community plan. We also have a community plan too, but they involve all the organizations in the community to develop and basically make sure that the community is meeting their wellness goals. So I'll give you an example, like, if Wood County has higher heart attacks, and I'm not a medical person by any means, but if they have a higher incidence of heart attacks, then maybe we part of that plan is pushing out more fruit and vegetables. Obviously, we wouldn't be part of that specific plan, but if they develop or they see needs like suicide or depression or school-based needs, they might lean on us, and we work with them as a partner to say, well, we're going to do this, this, and this to make sure that we can improve the well-being of the community. We also work with them on certain special projects. It just kind of depends. We've had we've promoted some of their MAT, which is addiction treatment resources. They have some new resources, and we worked with them just to kind of help promote them as well. Even though we don't necessarily contract with them, we want the community to know about their resources as well. So yeah, we do have a relationship with them. I actually I get calls sometimes from their behavioral health. I think I forget what her title is, but Francesca Lease, she'll call me sometimes from the health department. Yep, and she'll ask questions. Sometimes I'm on same meetings with Ben, who is the new director, Ben Robinson, I think is his name. So yeah, so we have a pretty close relationship with them.
Okay, thank you.
Aimee, you probably covered it in some way in the course of the whole evening, but we've kind of not talked about the opioid crisis in Ohio, much less Wood County, as much because of the COVID crisis, but I'm sure it still exists, and it was probably in some of those charts you had, but I didn't quite pick up. What is the status here in Wood County?
It's still a problem, unfortunately. I wish I had better news on that. We actually had a presentation recently from Annie Wilson, who is our addiction response collaborative coordinator out of the prosecutor's office. We help fund that position and help oversee. I'm actually doing some supervisory oversight to help with Annie. And unfortunately, their numbers are astronomical as compared to this time last year. She did a really great presentation. Yeah, so what they basically do, the ARC program, they respond to non-fatal overdoses. So they will work with individuals and families when there is a non-fatal or could be fatal, obviously a non-fatal overdose. She works with people to get them into services and treatment, whether it's inpatient, outpatient. And I don't have her numbers, to be quite frank, but they were pretty sobering statistics. I'm sorry, my cat is having his nightly ritual of walking around the house meowing.
Oh, I didn't hear. Any more questions for Aimee? I guess we've questioned out, but we certainly appreciate your efforts, your time. I am impressed, as I said before, with all the things you at the ADAMHS board and all your agencies have picked up on in this short span of months, because you weren't including that in any of your budget or other plans, clearly, and you've done what looks to me a very good job of trying to take care of as many people as you can at a time where there's increased problems, not less problems.
Absolutely. And like I said, we're always open to ideas. I don't want to tout myself as the expert in this. I want to hear from the community. So if anyone has any ideas or thoughts about things that we could be doing that we maybe aren't doing, please shoot me an email, because I can't necessarily do everything, but we're going to look into it, and if it's a possibility, we'll pursue it. So
sounds that you will. Yes. So thank you again. Thanks to our media people, Jan and Roger, for being here tonight. Thanks to all of you from the league who are here tonight. Paul, you have somebody there that I don't know, I think. Turn your mute off.
he's on mute.
I know, wait for it. I was on mute.
Yeah, I say you have somebody here that I don't think I know.
Yeah, well, Dinah's living with me, so that makes her an important person in my house.
Yes, yes. Well, we're glad you could join us tonight, Diane.
Thank you very much.
Yes. And you might want to think about joining the league.
Well, I just want to thank everyone for their time and listening to my presentation. If there's something that you would like some more information on that maybe I just didn't touch on enough, let me know. I'm happy to do another presentation or just get you the resources, whatever works best.
All right. Well, thank you again. We appreciate
Doing a wonderful job, Aimee. Thank you very, very much.
If we were
very
At
much.
the library, we'd be adjourning for refreshments, so you'll have to get your own tonight. Sorry. We even
My
had
own water.
big cookies, didn't we, Lee? Remember from the thing in January that we were gonna serve in March?
Actually, Shara, if we were at the library, they'd be shooing us out the door.
Yeah,
That's true.
They'd say
I
it's
still, I have a few dozen
8:28.
cookies.
2 minutes early. I told Amy that we had time and she added all this information. I never asked her to add. Well, I did, but not in quite such depth because I didn't know she'd have that much to say about what's happening now with the crisis with COVID.
Yeah.
I'd only asked her to do mostly on the protocol and some of those things that we heard a year ago from her. We didn't hear about this stuff. So
What a
I'm
treat.
very glad to hear that tonight.
Hopefully I didn't bore you all to death.
Mhm.
I don't think
It was
so.
a good bonus.
Thank you.
Thank
Yeah.
you.
Thank you very
Be
much.
educated. I'm gonna end the
Thank
meeting.
you.
Okay.
Thank you.
Bye.
Bye now.
Memphis.
Yeah.